Hello, I'm David Goldman with the FDA's Office of Food Policy and Response. And today I'm representing the Office of Disease Prevention and Health Promotion at HHS, as well as members of the Federal Interagency Work Group on Food Safety, represented by members of the FDA, FSIS, and CDC. I've been asked by the meeting organizers for our meeting on Healthy People 2030 to present a very brief overview of Healthy People, as well as a specific focus on some of the food safety targets that we are all interested in working on. So what is Healthy People? Over the past 40 years, the Healthy People Initiative has established data-driven national objectives with 10-year targets to improve the health and well-being of our fellow citizens. Healthy People is grounded in the principle that establishing objectives and providing benchmarks to track and monitor progress over time can motivate, guide, and focus action. It not only underpins HHS priorities and strategic initiatives, but those of other departments who are involved in Healthy People work. Beyond the federal government, Healthy People is used by state and local health officials, community health advocates, non-governmental organizations, researchers, and even businesses, all of whom seek to improve the health of their constituent populations and address the social determinants of health and advance health equity. Just to provide a few examples of how Healthy People is put into practice, it is used as a model for state health improvement plans and community health assessments, as a resource for securing public health accreditation, to provide metrics for measuring program performance, and other countries have used Healthy People as a model for their own disease prevention and health promotion plans. Healthy People has been around for 4 decades. It is now in its 5th iteration, and Healthy People 2030 was launched just over a year ago. This initiative builds on knowledge gained over the previous 4 iterations. In this slide, you can see the evolution of Healthy People across the decades. Healthy People has evolved to reflect our most current science and knowledge to address the latest public health priorities and challenges. And as a result, each decade's Healthy People efforts have moved upstream, intensifying efforts to reduce health disparities and increase health equity, as well as to expand to embrace the social determinants of health. For example, looking at the overarching goals, the second generation of the initiative, Healthy People 2000, introduced the concept of reducing disparities. Healthy People 2010 raised the bar to eliminate disparities. Healthy People 2020 not only called for the elimination of health disparities, but also achievement of health equity, and added an overarching goal to look at social determinants of health. And now today, Healthy People 2030 has gone further by adding the attainment of health literacy, and has broadened the social determinants of health to include economic environments as well as the social and physical environments. If you'll also look at the bottom of this slide, the number of objectives has evolved over time. You can see that in the first 4 decades, the number of objectives had increased significantly, but in this recent iteration for Healthy People 2030, we've demonstrated a nearly 75% reduction in the number of objectives. And this reflects user input calling for a comprehensive yet more streamlined and focused set of objectives. We know that efforts required to eliminate health disparities and achieve health equity extend well beyond simply promoting healthy choices. The social determinants of health, which have become so vitally important to achieve the Healthy People goals and objectives, are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. The Healthy People 2030 Social Determinants of Health framework is conceptualized in this graphic and identifies 5 key domains that influence health. You can see them here: economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. Each of these 5 domains reflects a number of critical underlying factors that impact the social determinants of health. I'll note here too that food safety doesn't fit neatly into any one of these 5 determinants. However, food security, the concerns with food deserts, fits into the neighborhood and built environment. And we have all been concerned about the availability of nutritious foods in some of our communities. Healthy People 2030 is composed of several unique elements that complement one another, and they're designed to ultimately influence the vision of Healthy People 2030, which is a society in which all people can achieve their full potential for health and well-being across the lifespan. These elements include overall health and well-being measures. There are 8 of those. The leading health indicators, which I'll get into in just a moment, as well as core developmental and research objectives. Here is a listing of the 23 leading health indicators. This subset of health objectives was chosen because they are among the major causes of death and disease in the US. And although we know the statistics around foodborne illness and the significant impact of foodborne illness on our nation, it is not among the 23 here. Here's a little bit more detail on the various objective types. Within the food safety topic area, there are 10 core objectives and 11 developmental objectives, and we'll get into that a little bit more in the second portion of this discussion. The research objectives are those that are based on concerns about public health issues for which there are no or not yet any evidence-based interventions and require more research to build a strong evidence base that is necessary to tackle those particular problems. The developmental objectives do not have reliable baseline data, and so can be transformed into core objectives in the future, but as of yet are not considered core objectives. Let me turn now to a little bit more of a focus on the Healthy People Food Safety Work Group, and we'll get into some of the details about those objectives. The Food Safety Work Group is led by the FDA and USDA FSIS, which coordinates the work products under the direction of the Office of Disease Prevention and Health Promotion, which again is the primary sponsor of Healthy People, and the National Center for Health Statistics, which is part of CDC and provides statistical and data collection expertise. The Food Safety Work Group also relies on the efforts of topic area subject matter expertise for information about data, to develop the objectives, and to track progress over time. There are some specific roles I wanted to highlight here on this graphic. Within the FDA, our representative to the Food Safety Work Group helps to inform FDA leadership about the progress and activities of Healthy People, identifies and communicates public health priorities based on Healthy People data, and importantly, that last bullet there aligns current and new work streams to Healthy People objectives in order to achieve targets. There are some activities that are specific to their work with the Office of Disease Prevention and Health Promotion, which I won't go into here, but I'll note also in that lower right part of the slide, there are some activities related to work outside of the FDA, including identifying scientific advances and bringing those back to the agency for further evaluation by our food safety experts. But importantly, meetings like this with AFDO and its invitees to this meeting represents relationships with other stakeholders that are critically important to moving Healthy People forward. In this slide, there are a couple of examples of the 2 of the specific food safety objectives that will be subject of the meeting coming up. One on STEC shows the baseline and the target, and in this case, based on input from subject matter experts, a 20% improvement was judged to be both ambitious but achievable. generally, healthy people targets are meant to be aspirational, but within the realm of possibility. The salmonella target on the right side of the slide shows the baseline and the target, which represents roughly a 25% reduction. This target was set based on alignment with the new performance standards for salmonella in poultry that was set forth by FSIS in the recent past. In the next two slides, I'll just show you the 4 objectives. There are 10 of them, as I mentioned. 4 of them have to do with pathogen reduction. 2 of them have to do with reducing or limiting antimicrobial resistance. And then there are 4 that have to do with consumer behavior, and they are depicted in this slide here. If you were to click on any of those hyperlinks on the previous slides, you would see a screenshot such as this, which shows the baseline information, the target, and there's some more details provided on each of the slides about the particular objective. And similarly for salmonella illnesses, you see here the baseline, the target. By the way, the baselines for the reductions in foodborne illness pathogens has to do with data from FoodNet. And then I wanted to show you this last objective, which has to do with our third work group dealing with retail, food service, as well as norovirus in particular. Healthy People 2030 marks the first time that norovirus has been explicitly called out. In Healthy People 2020, for example, there were 10 employee behavior objectives, and some of those have been retained. There are still objectives for employee hand washing, sanitization of food contact services, and hot and cold holding temperatures. But this is the first time that there has been an explicit objective regarding norovirus. And you can see here, it is to reduce the number of norovirus outbreaks. It is considered a developmental objective because there is not an approved data source to establish a baseline from which to mark that reduction. And finally, here there are the Healthy People 2030 Food Safety Working Group data sources for the 10 core objectives that I just covered. As I said, FoodNet is the data source for the reductions in infections. Then NARMS is the data source for the 2 objectives related to reducing resistance to, or reducing infections caused by resistant organisms. And then the last 4 objectives dealing with consumer behavior are depends on the Food Safety and Nutrition Survey that is issued periodically by CIFSAN at FDA. And lastly, I wanted to show you the final progress for food safety objectives from Healthy People 2020. In Healthy People 2020, there were 33 objectives that were measurable, and roughly half of them, the targets were either met or exceeded. There were another group where there was some improvement, and I will note that both salmonellosis and infections caused by E. coli were among those that showed some improvement but did not meet their targets. With that, I would invite you to learn more by going to this web link here. This is the Healthy People site. You can go into some of the details and learn more about not only the food safety objectives, but any other objectives of interest to you. Thank you for your attention, and I look forward to our discussions at our meeting.